Hi guys, Tom Krupar. I'm going to show you a very simple exercise to build up the front of the thigh, and this is called the straight leg raise. A couple of different reasons we could use it is if your thigh is weak, if you are post-operative on your knee, or if you're just having general pain because of weakness in the leg. The most important part of this exercise is that you keep the knee perfectly straight during it. You can do this either sitting up straight or lying down. Either way is okay with me. You can do this on the floor, on your bed, on the couch, whatever's most comfortable. And you can also bend the opposite knee up if you like. So again, the most important part of this exercise is keeping that knee locked as straight as you can. So you're going to tighten up the thigh, push the back of the knee into the table, and then you're going to lift your leg off the table. You want the toes to be pointed either perfectly straight up and down at the ceiling, or your therapist may have you turn the foot outward. So if it's your left leg, think about a clock dial. We may have you turn out to 11 o'clock. If it's your right leg, we may have that foot turned out to 1 o'clock on the dial. So however your therapist wants you to do that. So again, tighten the thigh very tightly, push the knee back into the table or into the bed, and then lift up. I'll pause at the top and back down. Tighten again, lift, pause, and back down. Always retighten before you do your next repetition. Okay? Now, if you do this laying on your back, I do want you to keep the opposite leg bent up because that will take some pressure off of your low back. And again, foot pointed straight up or off to 11 o'clock for the left foot, off to 1 o'clock for the right foot based on what your therapist wants. Tighten that knee up nice and tight. Lift it up. Pause at the top. Back down. Press again. Tighten that knee. Lift, pause, and back down. Okay? Very important that you lock that knee perfectly straight before you go up. If you do have a lag and you can't keep it straight, so if you lift that leg and it wants to bend a little bit, it's not ideal. It's not what we want. We want that knee to be perfectly locked, but we'd rather have you do the exercise and we can make some accommodations until you get strong enough, but try to keep that knee as locked as straight as possible. So you're going to want to do 10 repetitions of that initially. Work your way up to where you can get 30 repetitions. Initially you'll break that into 3 sets of 10 or 2 sets of 15, but eventually you're going to want to get 30 repetitions of that at least one time a day. Your therapist may have you do that twice.